As I look at this picture here of the Vita Classic Shade Guide in the color space, it makes me feel a lot better about the way I struggled to take shades over the years. You can see B1 completely outside of the color space there on the upper left because it's not a color that actually occurs in nature. And then D4 is way out of the color space down there on the lower left. And it looks like when you look at those tooth images that you just took a handful of like fingernails and then threw them out like you were shooting craps, and they just kind of randomly splay out there. And if you compare that and contrast it with what you see when you take a look at the Vita 3D Master System, look at that. You've got equal spacing from left to right and equal spacing from top to bottom between those different shade families, the 1M1, the 2M1, 3M1. All of those shades are scientifically laid out within that color space. The Vita Classic shade system was based on prevalent denture tooth shades in Germany in the 1950s. And you can see the OM1 3 shades are up out of the shades, out of the typical color space because they don't exist in nature. Those are bleach shades, and you don't see those naturally occurring, but certainly after somebody bleaches their teeth, you might have the need for that. And so this equal spacing, especially the vertical equal spacing, allows for half shades. So if a dentist finds something that's a lower value than a 1M1, but a higher value than a 2M1, for example, we can actually match a shade in the middle. What you'll notice when you start to use these shade tabs are that the Vita 3D Master shade tabs just match natural teeth better. And so I'm happy to say that here at Glidewell now, 20%, a full 20% of our shades are these Vita 3D Master shades. And that comes from about 2% when I started here 12 years ago. So I'm glad to see that on the rise. And if we look at a regular Vita Classic shade guide, most of us were taught in dental school to arrange it by value. And so obviously when it comes right out of the box, it's kind of worthless the way it's set up because it's just kind of set up alphabetically. And this is one that's been arranged by value. But you've probably seen us do this before. If we make this black and white, there's certain things that jump out, like A2 is actually higher in value than D2. And this is actually arranged by value according to the directions that are right in with the Vita Classic Shade Guide. So Vita actually will be the first to tell you that, hey, you know what, these colors, they aren't the most scientific, when it comes to matching natural teeth. Unfortunately, it just happens to be the language that we all speak in terms of color in dentistry, and they continue to do so in dental school today. But there's no doubt when you see the Vita 3D Master shade tabs in the mouth that they definitely match natural teeth better. And they give not only our technicians, but all dental technicians a better chance of matching a crown to an adjacent natural tooth when you use those shades. So the next thing I want to show you is a survey. Now this says it's a study that we did on over 2 million crowns. And that's true, but we've now re-verified it, and it's now been proven on over 4 million crowns that have come through the laboratory here, that this is the distribution of the most requested shade. So certainly the most popular shade is A2, and the reason why A2 is so popular is that in the Vita Classic Shade Guide, A2 is a huge bucket that encompasses about 3 to 5 other 3D master shades, and that's the reason it's so popular. When you use something like a Vita Easy Shade Compact, the digital shade taking unit, you'll notice that I've seen that when I get an A2 reading, it'll give you the 3D reading at the same time, and oftentimes it'll break it down even further. So A2 is very popular, but it's not very accurate when it comes to shades. It's way more accurate with the 3D system. A3 you can see is the second most popular shade, then A1. Then B1, that's probably a mistake, because B1 happens to be the most remade shade in our laboratory as well. It's 4% of the requests that we get, and it's 11% of the remakes that we do. So B1 is the most remade shade in our laboratory. Right next to it, A3.5, that is the least remade shade in our laboratory. I love that shade for any posterior tooth for anybody over the age of 40. Then D2, D3, C2, C3, C1, B2, A4, and then finally in about 11th position, we see 2M2 and 2M1, and that's just because, as I mentioned, it's now about 20% of the prescriptions that we see coming in with the 3D master shades. Hopefully those will continue to move up. But if I say what's the most popular shade to a room full of 200 doctors, almost all of them will either say A2 or A1. they'll say one of those two and they'll say it very loudly. Never do you hear a voice from the back of the room say 2M1, the 3D equivalent of A2, because unfortunately it's not the language that we speak. Now, I've got a good friend who's a dentist who sends a lot of work here to the lab, and he's got a remake rate of 8% for shade alone. That doesn't even take into account fit and things like that. Shade alone is 8%. So here's what I've had him do. I've had him take his Vita shade guide and take it from the one that I showed you earlier, where it's arranged according to value. And I've had him and many other doctors who I've consulted with on the phone about their shade remakes switch it to the most likely or the most popular shades in America based on those 4 million crowns. So again, just like that graph, it's A2, A3, then A1, then B1, which probably shouldn't be in there, but we let the patient see it too often. And like moths to a flame, they see that white and they're like, oh, must have white tooth. And you're like, it looks way better as a shade tab than it does as a crown. Because here it looks decent as a shade tab, but B1 crowns, woof. They are dogs. They don't match a lot. But patients just can't help themselves. They want all their teeth to look like that, not just the one crown you're doing. So that one should probably be gone. But A2, A3, A1, B1, A3.5, D2, D3. This is the likelihood that any shade that you're taking on a tooth, this is the most likely shade and this is the least likely shade. So this will be happening a good 30 to 40% of the time. And this should not be happening very often. D4, that term they have for in Calgary recently, last year, they had a bunch of floods and they called it a 100-year flood. This is a 100-year shade. You literally should be prescribing this once every 100 years. So if your grandfather was a dentist and your father was a dentist and now you're a dentist, between the three of you in your entire careers, this should have been prescribed once. It's that much of an event. I would invite the local news over. I would celebrate it with the patient. Consider having a parade maybe down the main street of your town. This is not going to happen very often. If you're doing this more than once, it's the wrong shade. I can just guarantee it. The chances are it's going to be this, and then in decreasing likelihood as you work your way over. And we've seen a lot of dentists lower their shade remake by doing this. But really the best advice I can give them is just to switch over to what Vita now recommends, and that is their 3D Master Linear Guide or Value Guide. And this is the one that I use and that I love. And so obviously it's a little bigger than a regular Vita shade guide, but as you'll see, the shade guides themselves aren't any bigger. It's just in this nice little package. And one of the difficult things about using the conventional shade guide is that we have to measure value, hue, and chroma all at the same time. In reality, 80-85% of the job is getting the value correct, but we've got all these other colors in here too, and even when they're lined up by value, it's a little difficult to do. So Vita's really made it simple for us with the value guide. This is the value guide of the part of this 3D Master system here. And you can see it's pretty simple. We've got 6 different value families to choose from. So the step 1 is just to have you or your assistant, and if your assistant is a 30-year-old female, she's probably got great vision, why not let her do this? It's pretty easy. This isn't technical dental knowledge. This is hold this up to the tooth we're trying to match and see which one matches. Really, no dental knowledge helps here. In fact, you might be more unbiased if you don't have any dental knowledge, so that might be a way to go. And when you look at this, you can see our bleach family here, the 0 or the O, OM2 or 0M2, and the 5. These are kind of the outliers, as is the 4. Even the 3 is not that frequent. Most of what you're going to do is going to be in the 1 to 2 with a few 3s thrown in. Maybe a 0 if the patient's bleached or you're matching a bleach restoration. And the 4 and the 5 aren't going to happen that much. But as you might be able to see, it's pretty simple here, because instead of trying to match everything all at once, all we want to do is hold this next to the natural tooth and see where it falls in terms of value, in terms of how light it is on the white to black scale. And obviously there's a pretty big difference. These two are the closest, but that's because of the camera light. It's a little easier under the lip. And if I get it in a little bit of shadow, you can see that it's darker. As you go in and hold these into the mouth, if you get this part correct, you're 80% of the way there. And so if you put it in there and go, yep, it looks like that 1M2 is the closest value family 1, then you move up to the hue chroma shade guides over here. So if you've selected a 1, we pull this over, and then you'll notice there's 2 shades here, the 1M2 and the 1M1. So it's just a choice between these 2. And so now all we're talking about is shift in the red-yellow spectrum here once we've nailed down the value family that we're looking for. Or let's say that you use the value guide and decided, or you and your assistant together decided that it was a 2, that it was from the 2 family. Again, that's 80% of the job. Almost any of these shades that I'm about to show you in the 2 family shade guide are going to look good in the patient's mouth because they're relatively subtle differences between the 2, because we've gotten the value correct, and now we're just trying to get the hue and the chroma here. But you can see, a little more yellow as you shift back and forth, and a little more brown. But you can probably tell, and I've proven this with CAD/CAM restorations, where we'll make restorations and we'll get the value family right, and then make restorations out of all these different shades, and they all look good in the mouth. You put them in, you go, you know what? 90% of dentists would put any one of these in. But this helps you kind of dial this in as you shift from the M, the more neutral, to the L's and the R's, and work your way back and forth through here. So once you've identified it as a 2, again, you're 85% of the way here. Hold this one in and go back and forth and see which one of these is the closest. If you can't decide, you can take 2 of them out, for example, and then hold them both by the tooth that you're trying to match. You hold them or your assistant holds them while the other one takes a picture. And so you have them both in there. Just be sure you don't cover, obviously, like the names of the shade tabs, with your thumb. And so even if a material we're making a crown out of doesn't come in a 3D shade, let's say I choose a 2M1, and I'm going to have something like an Emax crown done and it doesn't come in a 2M1, we're still better off working with that, because our technicians will go, oh, 2M1, that roughly converts to an A2 in the Vita Classic Shade Guide. So they'll get an Emax block and they'll mill it out of A2, but then when it comes time to characterize it at the end, they're going to grab the 2M1 that you gave them a photograph of in the mouth next to the tooth, and that's what they're going to use to characterize that Emax crown in the final stages. So even though it's an A2 base shade of the crown itself, they're going to characterize it using the shade tab. And if in your picture, next to the natural tooth that we're trying to match, they look at it and they go, oh, the 2M1's a little higher in value. Now when they're making the crown, when they put this next to the crown, they'll make sure that this is a little higher in value than the crown itself. So even if the material that you're prescribing for the restoration doesn't come in the Vita 3D shades, it's still more helpful to use this. Remember, anytime you take a shade picture, make sure there's a shade tab in. Telling us that it's an A2 and then taking a picture of the tooth by itself, because of the variation of colors on people's displays, yours versus ours, it's very difficult to really make that meaningful unless there's a shade tab in place. So any picture concerning shade needs to have a shade tab in place, even if it was in left field. Even if for some reason you chose, I don't know, like a 4M2 and it was clearly not the right shade, but somehow that's the picture that got sent, at least the technician could go, whoa, look how dark that is compared to the natural tooth we're matching it to. And when they put the crown next to it as they're doing the final characterization, they could try to get that same kind of difference between this being so much darker than the crown they're working on. So the bottom line is, if you're in the market for a new shade guide, and if it's been more than 12 to 18 months since you have one, you've probably been putting your old Vita Classic guide into the cold sterile. And as you do that, the glutaraldehyde will eat the glaze away at these shade tabs, and the value of all of these shade tabs will rise, giving you some inaccurate shades. The good news is all of these shade tabs, well, including the new Vita Classic ones, these can all go in the heat sterilizer and should go in the heat sterilizer. There's no damage done to any of these when they go in the autoclave. The only way to damage these is to put them in cold sterile, which eats away the glaze on the teeth. But if you're considering getting a new shade guide, or you're at that time, I want you to think long and hard about getting the linear guide, because when you use the value guide to narrow it into which value family it is, and then you pull out the associated hue and chroma guide, it's really going to dial it in for you. I realize it's 2 steps as opposed to the old-fashioned 1 step that we've been doing, but I'd rather do 2 very accurate steps, or easier steps to get an accurate result, than 1 step and go, oh, it's quicker, but have it be more difficult and less likely to be correct. I think you're going to find, like I have and like a lot of our dentists have, that the Vita Linear Guide is a step in the right direction for getting better shade.